If you haven't liked our Facebook page yet, now is your chance. Facebook.com/SF17 Studio Chatter. Get involved in the chatter. Got an idea for us? Share it. Welcome back to Studio Chatter. Chances are you have a neighbor, a friend, or even family member that suffers from a drug addiction. Welcome Annie Nicoles from the Department of Drug and Alcohol Prevention and Treatment to the conversation.
Thank you. Thanks. I'm excited to be here, and I'm glad that you're willing to talk about it.
Absolutely.
Yeah. Let's start with the initial conversation of what is an opioid. Is that even
opioid? Opioid, yeah.
Versus opiate.
Yeah, so opioid is the more common umbrella term that's used to describe any type of opiate, opium, right? So it can kind of be
drugs, right?
Right, yeah. So opioid includes both naturally occurring forms of the drug from the opium poppy plant and also synthetic forms of the drug that are created, by drug manufacturers to mimic those effects that happen from the natural plant, if that makes sense. So so opioid covers both naturally occurring from the opium poppy plant and then synthetic versions of the drug as well.
Learned something new already.
Yeah, and there's lots of different types. So opioids are typically used to treat pain, right? So they decrease the pain response, increase feelings of euphoria, which is part of what gives it potential for addiction, right? It is a psychoactive drug. It's usually prescribed. Most forms of opioids are legal, so things like Percocet, Oxycontin, hydrocodone, codeine, methadone, Vicodin, maybe I already said that one. Lots of different types of prescription opioids, and there's also illicit or illegal opioids like heroin, which is the most common illicit opioid.
So unfortunately, I think that's probably why we have been, why we've come to know the term in the past probably 2-3 years. We see it all over, billboards, opioids, beware, the overdose, so why the epidemic?
Yeah, so epidemic is a word that public health statisticians typically use to describe a health issue or event that's happening at an excess rate, way more than it should be or than it ever has been or that it's expected to. So because our overdose death rates are skyrocketing, and they have been for the last 10 years, that's why you start to hear the term epidemic. So it's a national crisis, but it really is affecting our state and our county and even this local area as well. So nationally, our overdose death rates have tripled in the last 10 years.
Wow.
Which is crazy.
In the state, you mean, compared
as
to...
a nation, our rates have tripled. And our state follows that same trend. So we're 7th in the nation for overdose death rates. Yeah, it's killing more people than motor vehicle accidents. And yet, you hear all about click it or ticket and buckle up, which is great, but many more people are dying from overdoses than they are from those other types of death.
Goodness.
In our county, we lost 179 people last year to specifically opioid overdose deaths, and 38 of those came from the Spanish Fork, Springville small area.
And is this including children, would you say?
Most children don't overdose on opioids. Yeah, that's not really the demographic that it affects most. You'd probably be surprised with prescription opioids. Those who are most overdosing are actually women, ages 35 to about 54. Wow. That's not what you typically think of when you think of someone overdosing right now.
You're just starting life, you've got young couples and families.
Or people typically think of an IV drug user or someone from the homeless population, right? There's kind of these stigmas and stereotypes attached to people that misuse drugs. And prescription drugs don't necessarily follow that trend.
Right.
Heroin is different. The people who are most overdosing on heroin are young males, 24 to 34.
Is it almost like street?
Yeah, so heroin is really only used illicitly. Injected intravenously typically. So,
but is there a reason for this? Why? Especially for women. We're women here. We're young. We are in that category.
She's delusional.
You are.
Why? Though we are, but
in that age gap, we're in that age range.
Maybe it's because it seems to be more accessible, or
absolutely.
Is that why?
Oh yeah. It's a complicated problem, and how we got here is complicated as well. But really, in the 90s, it started with a push on physicians to better treat pain. And as patients, our our expectations changed. I shouldn't feel pain after a surgery. That shouldn't be a normal part of my life. And so there was pressure on physicians to better treat pain, so they started looking for options. And then you had drug manufacturing companies creating things like Oxycontin, which really revolutionized the way opioids work in your system. So the cotton in Oxycontin stands for continuous, which means even hours after you take the drug, it continues to have the effect in your body, right? Which was great for treating pain, horrible for addiction. And at the time that was released, physicians were taught that this was a safer form of opioids. This form was not addictive. You could prescribe this to your patients without worrying. And so that's what happened. That's what they did. And now we know that that's not true. But at the time, that wasn't necessarily the case. So now we know you can develop dependence to an opioid in as little as 7 days, even if you're using it as prescribed.
That's all?
Really?
Yeah.
And when you say pain, as in physical pain or even mental, what about mental? If you're Are they using it for depression, anxiety?
No, not typically. So it's usually, the CDC recommends that it's only used for cancer patients or like extreme chronic pain, end of life type of care. But it's more commonly used for acute injuries, like you break a bone, you get an opioid. You get your wisdom teeth out, you get an opioid.
Right.
And there are other ways to manage pain that don't carry such a risk. You typically see other types of drugs to treat things like anxiety and depression.
So on that note, is there anything being done, I guess, on the physician side that's being taught differently about that now? Are they being taught to manage the pain differently, or? Yeah,
absolutely. And it's coming from the healthcare industry and also coming from public health professionals as well. So the CDC published prescribing guidelines. So they have 12 really specific guidelines. If you're going to give an opioid, this is what you should give and how much of it and how you should taper them off and the plan you should follow.
Interesting.
So all of that is slowly being integrated into the education and training of medical professionals. But you still have a whole body of professionals that have been practicing for decades that maybe learned another way. So the healthcare industry is working on it. I think they acknowledge their role in kind of creating the problem. They're part of part of that problem, right? But even in industries like in around healthcare are strong advocates. They've come out saying we're going to curb our overprescribing. We're going to decrease it by, they said 50 or 60%. So they are working on it. And there's also policies that have passed to kind of help to solve the problem, right? Like one was the creation of what's called the controlled substance database. So that software that physicians and their staff can go in and pull up a patient to see whether they have other opioid prescriptions from other providers, if they've gone to 5 different doctors in the last 5 months. Okay. So that's helped to decrease kind of what we call doctor shopping. They're going from one physician to another, seeking that medication. So there are things that are happening, and I think that they're doing a great job of identifying that they're part of the problem and really working to be part of the solution too. But it'll take time. The
re-education of women, or the people that use us, as well. Yeah,
definitely. So in Utah, we're really lucky to have a great public awareness campaign that's funded by the state legislature. So that's Use Only as Directed. I don't know whether you guys have ever seen that. And their whole goal is exactly what you just said, to educate patients on what they can do. And they promote basically 3 things, which is speak out, opt out, and throw out. So speak out being like, you can take an active role in your healthcare. If you're going to take an opioid, ask your doctor these questions first. Am I at risk for an addiction? Are you prescribing the lowest possible dose? What's the plan to taper me off? Will something else work? Basically saying if your physician isn't going to have these conversations with you, you can take an active role in that. Opt out being look for alternatives. There are other things that are proven to work, but they're hard. It's like physical therapy and exercise, and then throw out, meaning get rid of your prescription medications. Yeah. Stop saving them. You don't need them for an emergency. Right. You don't need them for your child. After you're done, take them to a drop box. And there's drop boxes all over. Spanish Fork Police Department, Salem, Mableton Police Department, Springville Police Department. Right. There's 6 just within a few miles of us. Right.
So let me ask this as we wrap up. What can we do if we have a loved one or a neighbor or recognize this abuse around us?
Yeah, so definitely one thing to do, like we said, is disposing of your medication. So 75% of people that misuse opioids get them from a friend or family member. So remove the accessibility. The other thing is if you are in contact with anyone that uses an opioid in any way, you should get a naloxone kit. So naloxone reverses an opioid overdose. So chemically, it undoes the effect of an opioid. Like you'll have people that have overdose that are not breathing, that are blue. You administer them naloxone and they revive. And they're suddenly breathing and they're alive, and that's another chance for them to get into treatment.
The police department now has it with them, right?
Yeah, so naloxone, that's one thing we've been working on. So most law enforcement agencies in our county all carry naloxone, but you can go get naloxone too.
Okay.
Anyone can get naloxone at almost any pharmacy without a prescription. It's covered by most insurances, including Medicaid.
Oh, wow.
If you have to pay out of pocket, you can pay like $20 to $50. So go get a naloxone kit. Like it is the Lazarus drug, is what they call it. It literally reverses life. It's incredible. So those would be kind of the two things that I would say that people should do. Yeah.
Oh, thank you.
And can people contact you? Do they contact your department?
Yeah, absolutely. So we have
work?
free naloxone kits that are available to community members that are close to someone who's at risk of overdosing. We also offer free classes on overdose prevention education. So how do you identify the signs? How do you administer naloxone? Where do you go for help? Right? So all of those things, they're more than welcome to contact our office.
Do you
What's
have
your
a number?
website?
So it's 801-851-7139, and that's my direct line. So we're happy to connect them with those resources.
Fantastic. And we'll get that all posted as well. Just fantastic information. Thank you so much for joining us.
Thank you for having me.
Coming up next, what are your favorite gifts? Stay with us.